She had quite a bit of disease in the omentum and just kind of scattered around the belly cavity, but that's what took so long, is we just wanted to get every little bit out. And her pelvis was just kind of socked in with it. We had to work quite a while in there to get all that out. And both ovaries were involved and things in the pelvis. So we did a hysterectomy, removed both the ovaries. We removed the omentum, which is a fat pad that hangs off the colon, and it soaks up anything bad that's happening. And it had soaked up quite a bit. We got rid of that. And then the rest of it was just removing every little thing that we found. So she did good. We might end, I'm giving her 1 unit of blood just because she started out actually for the unit today. And it was a long case. So we're giving her 1 unit. I'm going to test her, and that may be all she needs. If not, we'll give her 1 more. But she's doing good. She tolerated it real well, no problems. And she'll be in recovery room probably about an hour till she wakes up real good. And then we'll be moving her to the 2nd floor, and that's when you can see her. And they should let you know when she moves up to the 2nd floor.
So this cancer hasn't spread?
Yeah, it is spread inside the tummy cavity, but not beyond the tummy.
But you guys thought you got it all.
Yeah, we got everything big, everything bigger than, well, even smaller than this. That you never remove everything of a spread cancer for ovarian cancer with surgery.
Okay.
What you do is you get it down where it's just cells, and that's where the chemotherapy can work better, because if the chemotherapy has to dissolve a big tumor, it just can't get in there and do the job. So, what we did is what's called a debulking surgery, where we moved, all the big stuff, anything smaller, bigger than about 5 millimeters, which is about that big. And everything that's smaller than that, chemotherapy can get in there and do its job. So we are going to have to do chemotherapy. So.
And what are the ratings of survival on that?
Well, if you want, she's stage 3, and almost everybody with ovarian cancer is stage 3 because it has no early warning signs. It's usually always spread in the belly cavity when you find it. If you want to look, I'm not a big numbers person.
Okay.
But
I'm just asking, is she going to be okay?
Yeah, well, I hear you. All the numbers are the statistics you read in the books and the articles are just an average of people who are reported in various trials. And overall, 5-year survival, if you want to look at it in general, is about 30%. But that's kind of meaningless to the average patient.
Right.
Included in that big group of patients are people who never got surgery, people that their tumors couldn't be resected, people that didn't get the chemotherapy. It's a big hodgepodge. So that's why I say it's kind of meaningless. She's kind of the run of the mill right now, and the fact that she had the usual stage 3 disease. We were able to take it out, so already that's a click in her favor.
Okay.
We are going to have to follow with chemo. Almost everybody does respond to chemo at first. In other words, they start feeling normal again. The fluid all dries up. They feel great. Okay. By the way, her tummy is just totally flat.
Oh, good.
I drained 25 pounds of liquid out of her.
How many?
25.
Wow, that's like a baby.
She was full of fluid. Some of that'll come back, but not all of it. Until we get that first round of chemo in, and then it'll go away for good.
Okay.
Her stomach's really flat right now. Where we get into trouble with ovarian cancer is, 2 or 3 years down the pike if it comes back. Because if it comes back, the cells have kind of learned to outsmart the chemo. Now, sometimes we'll start the chemo again and we'll get back control of it. Mm-hmm. But when we lose people from ovarian cancer, it's usually several years down the line when it's come back and we've retreated and it comes back, and then finally it gets to the point where the cells aren't listening. Some people, it never comes back. I've definitely seen that, even with people who had as much as she had today. So you just never know. There's no way to predict it. It's always worth treating because almost everybody does get a few good years out of it at the minimum. Some people get long-term survival. We just don't know till we get it. Every patient's different.
Okay. So
right off the bat, she's in good shape because we were able to remove it. I can't say that for everybody. Sometimes it's in places we just can't get to it. But
good.
She's real aware. So right off the bat, that's good for us. And then we'll start the chemo probably 2-3 weeks from now after she's healed up from this, and we'll get her, plugged in with one of the medical oncologists to give the chemo. So, and it's not too bad. People tolerate this chemo really well.
Is this oral stuff or is
No, it goes through an IV, but it's given 1 day every 3 weeks as an outpatient. You just come in and we slowly drip it in the arm. Mm-hmm. And I've got people holding down full-time jobs on this chemo. It's as chemotherapies go, it's some of the kinder and gentler compared to leukemias and breast cancers and colon cancers and things like that. So she'll tolerate this. She'll get through it. But,
is there anything that might, with having that is it gonna affect how she eats and that
she's
afterwards?
going to eat a lot better than what I did today after she recovers. She's going to, her appetite slowly come back to normal because we drained all that fluid. Her bowels were just inflamed from just like laying in that soup, you know, that fluid
Yeah.
this whole time. And so she wasn't digesting her food right. That's why she's
Yeah.
lost weight here and arms. You know, She
Mhm.
was putting it all in here. And so now that that's gone, she'll actually gain weight on chemotherapy and start getting normal nutrition.
Good.
So that's good. She needs to do that real bad. So.
Well, thank you for taking care of her.
Oh, my pleasure. She did really well. And so we just play this one step at a time. It's not a hopeless situation. It is a serious situation. So we just gotta hope the best that she's gonna be in that good category that responds well. And there's no reason not to hope for that right now, so.
What about foods? Does she have restrictions in? Is there
No.
things that she shouldn't be doing?
Not really. I tell people that eat whatever they want while they're recovering from the surgery.
Oh boy, she's gonna be eating all those strawberry shortcakes.
Yeah, that's good. Just to catch up on calories.
Yeah.
But after that, you know, once we start getting into the chemotherapy, I like to have people on a low sugar diet because cancer loves sugar. Cancer feeds on sugar. And so, you know, that doesn't mean you never can have a cookie or a piece of cake, but just keep it in moderation, you know. So
Right.
We'll talk to her about that. And, yeah, well, she's going to feel so much better. I can't imagine walking around with how many gallons of fluid she had in her tummy.
Well,
That
she
was a
sure
big
did it for us for a long time.
Yeah, that's a big deal, so.
Yeah.
All right, well, listen, if any problems, any questions or anything, like that in the hospital, nurses always know how to get me. Of course, I'm not a nurse, but,
All right.
I would just guess maybe home Thursday, Friday. It just gonna depends on how quick she bounces.
Can
Okay.
I ask who's her like chemo doctors around here? Does she get to choose or?
She's got a good one.
She has one?
Yeah.
Yeah.
Higgenden or something like that.
Huh?
Is it Higgenden?
No, that's me,
that's
I'm
her.
David.
Oh.
No, it's Dr. Virgilio.
Virgilia, oh yeah.
Virgilia, okay.
Virgilia's
Dr.
great.
Virgilia.
Yeah, I love her.
My friend had her and she's
Yeah.
doing great.
She's top notch.
Yeah.